This short presentation will help you arrive informed about your first trimester visit and will minimize the amount of time that you spend in maternal fetal medicine. We will review first trimester ultrasound examination, additional testing options, how results are shared, and how to learn more about your insurance coverage for blood testing. The first part of the visit is the ultrasound examination. We ask that you fill your bladder by drinking fluid about an hour before you arrive. A filled bladder allows the sonographer to obtain optimal pictures of your baby. During your ultrasound, the sonographer will attempt to identify and document the gestational age by measuring the fetal length, the nuchal translucency, which is a fluid-filled area between the skin and the bones of the neck. In addition, we will attempt to obtain images of the fetal profile, including the nasal bone. Although the focus of this ultrasound is to measure the nuchal translucency, the sonographer will take additional images. However, there are limitations to what we can see at this early gestational age. You will learn the results of your ultrasound examination before you leave our department. A normal first trimester ultrasound decreases the chance for many conditions, but it does not eliminate the chance for issues. Following the ultrasound, we offer 4 additional testing options. One is to do no further testing at all. Another option is to do as much testing as possible, which would require an invasive diagnostic test such as CVS or amniocentesis. These tests come with a small risk for miscarriage, but provide the most information available. Keep in mind, there is no test for everything. Most people choose to do blood testing, which increases the overall detection rate for chromosome conditions. There are 2 different blood tests: early risk assessment, or ERA, and cell-free DNA, also called NIPT, non-invasive prenatal testing. Historically, we've offered ERA, a test of maternal hormones of pregnancy. It screens for 3 conditions: Down syndrome and 2 more serious conditions, trisomy 13 and trisomy 18, with a 95% detection rate. The false positive rate is 2%, or 1 out of 50 times we do the test, the result will indicate increased risk, when in fact the baby is not affected. When ERA comes back positive, we offer cell-free DNA testing for a more reliable result. Cell-free DNA is available in place of ERA if you wish. Cell-free DNA is also a simple blood test from the mother's arm, but it uses DNA that comes from the placenta naturally into the mother's blood. The false positive rate of cell-free DNA is less than 1 in 300. This test evaluates the chance for 17 different chromosome conditions, some of which are not detected by ultrasound, and includes Down syndrome as well as sex chromosome conditions. Because the test looks at the sex chromosomes, we can also tell the baby's sex if you would like to know. If not, we simply ask the lab to withhold that information. During this time of COVID-19, availability of the testing is reevaluated daily, and we may at some point be unable to follow up on abnormal ERA results. With this in mind, we currently recommend starting directly with cell-free DNA. Here is an example. If this baby was affected with Down syndrome, there would be an extra copy of chromosome 21 in every cell in the baby. Since the placenta and the baby are derived from the same initial cell at conception, the placenta and the baby most often have the same chromosomal makeup. The laboratory will detect extra fragments of chromosome 21 from the placenta that are floating in the maternal blood, indicating that the baby is most likely affected with trisomy 21. Occasionally, but not often, the placenta may not accurately reflect the baby's chromosomes. This is a picture of a karyotype, a presentation of the 23 pairs of chromosomes we all carry in each of our cells. These 23 pairs are considered typical. If there are extra chromosomes or extra or missing pieces of chromosomes, developmental consequences may occur. This slide reviews the conditions screened for by cell-free DNA. The condition most people are familiar with is Down syndrome, where there is an extra chromosome number 21. When there are 3 chromosomes instead of the usual 2, the condition is called a trisomy. Down syndrome is also known as trisomy 21. Children with Down syndrome have some degree of intellectual disability, are more likely to have certain health conditions, and most often live well into adulthood. Trisomy 13 occurs when there's an extra copy of chromosome 13, and trisomy 18 when there's an extra copy of chromosome 18. These conditions are more serious and life-limiting. The sex chromosomes, usually either XX female or XY male, may also have an extra or a missing chromosome. Disorders of the sex chromosomes are generally not as intellectually impactful as the other chromosome abnormalities, but have associated medical, behavioral, and learning issues. The remaining conditions that cell-free DNA screens for are called microdeletions and occur when there's a very small piece of a chromosome that is missing. All microdeletion syndromes are uncommon, but are associated with intellectual disability and medical conditions specific to the deletion. In addition, trisomy 16 and trisomy 22 are also part of the screen, but they more often are associated with early miscarriage. Results from early risk assessment, or ERA, are available in about 5 days. Your result will be sent to your OB's office and will be there for you to review at your next office visit. Results appear as a probability, not as a positive or negative. We call all abnormal results to the patients ourselves, and we provide all follow-up counseling and further testing options. Results from cell-free DNA are available within 10 days. They are presented as a positive or negative. All positive results reflect increased chance for a specific chromosome abnormality, and those with increased risk are offered amniocentesis to determine with certainty whether the baby is affected or not. Pursuing amniocentesis is always your choice. If you elect to not have diagnostic testing, we will continue to follow your pregnancy as though the baby could be affected. Regarding additional resources, we recommend that you go to these 2 websites, geneticsupportfoundation.org and lettercase.org. They provide informational brochures and videos related to cell-free DNA, the trisomies that were discussed during this presentation, sex chromosome variations, and the techniques of CVS and amniocentesis. Regarding coverage for cell-free DNA, we recommend that you go to integratedgenetics.com. Click on the pink Estimate My Cost button, and then click on Pregnancy. Then you need to click on the test that you're interested in learning about, and you are interested in learning about Maternity 21+. There'll then be a field for you to fill in, and Integrated Genetics will get back to you with an estimate of your cost. We appreciate that these are unusual times. We care about you and your baby, and will do our best to take care of you and protect your safety.